I came to needling. In 2012, I heard a lecture from Dr. Fernandez in Munich, where he showed impressive results after needlings. In combination with a vitamin A pre-treatment, it seemed to me that he needled nearly everything and everybody. As he told, his patients came to him since years, having a needling from time to time, and they were all using his vitamin A cosmetic. Everything seemed to be very simple, bloody but simple. Dr. Aust from Hannover, who is also in the auditorium, afterwards showed that the method also stands up to scientific demands. I think most of you know the literature from Aust and Fernandez. Everything seemed simple, only a little bit of cosmetic and a derma roller. When I went back home, this is my clinic, I argued, and my arguments against were how to sell my patients cosmetics I'm not convinced of, and second, the method seemed to be too bloody for an only rejuvenation treatment. And at last, does it really work? I'm a maxillofacial surgeon during facial plastic surgery since over 15 years. The procedures I do mostly are, beside fillers and Botox, blepharoplasties, facelift and rhinoplasties. Surgery helps restructure the face to a more youthful shape, but the old skin remains. For skin rejuvenation, I was using hyaluronic acid in form of skin boosters. I'm in a private hospital in the south of Germany, where also these nice cars come from, where people spend much money in facial plastic surgery, but nobody is to know. Everything is very discreet. When patients have surgical procedure, they normally hide till they rise like a phoenix from the ashes. Also, selling cosmetics to my patients, I first thought it to be difficult because there are so many cosmetic products on the market, and I wanted to sell something honest and of high quality, and I wanted my patients to come back. Funny is that I developed the method of Fernandez and Aust a second time for myself by first taking up a cosmetic line on vitamin A in my program, which in my eyes is outstanding and works very well. My patients and I love it. Then there were more and more the demands and questions of some long-time patients, which forced me in the direction of needling. As I told before, I was doing the rejuvenation with a skin booster. Also, patients today very often come before they need surgery, and they love minimal invasive procedures. The third thing that I discovered, the device from Amier made. And at last I had some results where I wanted to test the method and what I want to show you afterwards. Having a look at the beautifully designed device, I spontaneously fall in love a little bit because I'm a design junkie. But more important are the advantages. The device generates little noise and vibration and fits easily into the hand. The needles can be operated with a speed up to 150 hits per second. The needle length is freely selectable from 1 to 2 millimeter in mini steps. So I get the appropriate needle length for each area for sensitive or more aggressive treatment without changing the cartridge. I start with a short needle length and control the depths by the bleeding points according to the needled areas. There are 3 different configurations for 3 different applications. This is the one-liner for hard scar tissue, and this is the 6-point needle plate, which I use mostly. It is for acne or full facial cosmetic rejuvenation. The tilted needle plate adapts to the surface of the skin and assures perpendicular needle penetration and minimal epidermal trauma. This is one important advantage in my eyes to other devices. A safety membrane prevents backflow of liquids, and there is no risk of contamination of the handpiece. With help of a substance reservoir, there is the possibility to fill a substance into the cartridge with perfect penetration to the dermis. The cartridges are sterile and for single use only. My first patient I want to show is a 65-year-old woman who complains about the sagging of the midface, with the jowls and the platysma banding, but mostly about the old skin at the middle of her neck. Here she is before and 6 months after super extended face neck lift. Additionally, I did a microbotox treatment before and directly after surgery when platysma function went back, but the result for her was poor. She was happy about everything except of her neck. The problem was the quality of the skin, which will never be addressed through a lifting procedure. And at that time, I didn't do microneedling. The next patient, who had an extremely difference in aging between her neck and her face. I treated her first with the skin boosters, but the little points where I did the injections were visible for minimum 2 months, so she didn't want to have a second treatment. She was prepared for needling and got the vitamin A cosmetic, and 6 weeks later, when the skin was getting used to it, I did the first needling, followed by the second one 8 weeks later. On the right side below, she is directly after the needling and after washing off the blood. And here you can see the result pre-treatment and post-treatment. The third patient is a 57-year-old woman who had typical signs of aging in the face and upper neck, especially the submental area. She has a very long neck, which she was always underlining by putting her hair up. In the past, she had also had some skin boost treatments elsewhere without being convinced. Here she is pre-op and 6 months post-op after smash lift of the mid-face and upper neck. I didn't do a total undermining of the neck. She was happy with the result, but was complaining of the old skin on her normally beautiful neck, as you see here. The skin in the middle of the neck has a severe elastosis and an uneven texture. Here she is directly after the needling. She got the pre-treatment with vitamin A and after 6 weeks a needling. The result, pre and post-treatment. As a conclusion, needling is a safe and simple tool in facial plastic surgery with minimal downtime for the patients. With a device from Amier made from Berlin, it is a great addition to my treatments in facial plastic surgery. Meanwhile, I use it for only rejuvenation treatment or additional to facelift surgery to address special problems like the perioral or orbital area. Open questions are for me comparison and advantages, respectively disadvantages to fractional laser treatment and PRP treatment and PRP lifting. And I would be happy for tips from the auditorium concerning products for using during the needling, like hyaluronic acid or vitamins. Thank you very much for your kind attention.